Today, I'm going to talk about something that you probably wouldn't expect I would be talking about on this podcast, and that's Eastern medicine. Why? Because although I don't believe you should delay treatment or replace treatment with Eastern medicine, I do think it has its place and can complement your fertility journey. So today, you're going to meet somebody who's going to help us understand how to complement your journey, but not just that, but also improve your overall health. And by doing so, you will be able to not just feel healthier, but also feel stronger and more empowered in your fertility journey. From the Building Your Family community, this is the Building Your Family podcast. I'm your host, Lisa Schumann, author, researcher, and reproductive medicine therapist. As the leading destination for support and education for people using reproductive medicine to grow their families, we cut through the noise to provide you with research-based information, effective and actionable strategies, and the support you need to empower you to get into the driver's seat of your life and build the family of your dreams. We look forward to seeing you inside. Welcome to today's episode. We're glad you're here. I'm so glad today to introduce you to someone who I admire very much. Her name is Dr. Susan Fox. She's an acupuncturist and a doctor of Chinese medicine. So she has 20 years of experience. And although you've probably heard a lot about, from both my guests and myself, about how evidence-based research is really important, and we have to think about modern medicine as a driver in our fertility journey, it's also important to think about the things that can help us and not hurt us. And Dr. Fox will help us understand all the things that you can do, according to Eastern medicine, to help you improve your health and your fertility. So welcome, Susan. It's so nice to have you here. I'm really thrilled to have you here because I know you and I are very similar in that there's so much that can benefit people. And although we really value traditional medicine and research, and that is without question so important for people to look at, there are lots of things that people can do to help themselves in addition to fertility treatment.
Without a doubt. Thank you so much, Lisa, for having me. I'm really excited about this conversation. And it's true. You and I share that simpatico in knowing that while, conventional medicine is so important in helping people build their families, there's much that an individual and couple can do to participate, to like regain their agency over their whole health and their fertile health so that they can have better outcomes.
Yes, absolutely. So could we talk a little bit before we get started on what people can do about your story? How did you get here? Because I think that that's very compelling.
Thank you. Well, my story is a little different than the fertility story. A lot of times people have that, that Chiron wounded healer story where they've been through it themselves. Mine originated at a young age when I was having gastrointestinal issues that neither conventional medicine in gastroenterology nor psychology or psychiatry could help. And the surrounding history was that this was occurring at a time when I was going through a very stressful time. I was going through a very grief stricken process. My father had just passed away. I was living on my own. And come to find out years later, I was in the early stages of an autoimmune GI issue, but nobody could figure it out because it was really that long ago. I am that old.
Wow.
So being bounced back and forth between gastro and psychology or psychiatry, I wasn't getting any results. And this is in the late 70s, mind you. So
Mm.
acupuncture was brand new to the States. But I was ready to try anything. And it was fascinating and visceral to experience that with acupuncture, because at that point it wasn't even herbs, it was just the acupuncture. I was able to release this pent up stress energy that was in my body and make the connection myself that, oh, I was not resolving my grief and I was not taking charge, if you will, of my stress around that. So I was perpetuating the problem. And of course, now we know there's also dietary and other lifestyle things that I could have done, should have done, and was not doing. But lo and behold, 20 years later, I was able to find a niche in my own personal work life where I was like, okay, it's time. It's time to go into this area of work. And so I went to acupuncture school at age 40, and then I got my doctorate at age 60. So I really come to dive
Fantastic.
into and learn deeply how important I refer to Chinese medicine as traditional medicine and Western medicine as conventional medicine, just for semantics here. How important these traditional medicines are because they remind us of what we innately know.
Absolutely.
Yeah,
I can say that I'm 100% in agreement with you. And I think that it's really important for people who are listening to really think about where this fits in your life. So for me, I had a difficulty with my uterus and my fertility treatment, and I tried Chinese medicine, but Chinese medicine was not going to change the shape of my uterus. It was
right.
not going to change a lot of things that I had that were going wrong. It was not going to change my husband's sperm issue. And so I think it's really important for everybody who's listening to really think as we start to talk about this, which things fit for you and which things don't fit for you, because it's not a one-stop shop. We really need to think about what fits for each person, really get the right information, see your doctor, and then try to supplement with some of these things. I noticed even more recently, several years ago, I took chemicals out of my diet.
Mhm.
So, no potato chips and no white bread and nothing with chemicals in it. And all of a sudden, I felt lighter and happier. So I could see that gut health reaction and see that there really is such a connection between, your mood and your physical health and all of that. And I think recently someone, maybe it was on the Huberman podcast, was interviewed and said, we can create as many vaccines as we can think of, but if we continue to hurt ourselves by eating the wrong foods or eating too much or not taking care of ourselves and not exercising, there's no injection for that. Right. So I think we really need to think about all the pieces of the puzzle. And that's why I'm so glad that you're here today.
Thank you. I couldn't agree more. It is never an either or. And I really want to, sort of back you up and impress upon the listening audience that if someone's telling you my way is the way, get out of the way. That's probably not the right person for you because it really is an integrative approach. And as you well know and have experienced, Lisa, the professionals in our field agree with this as well. The concern is for those people who are being told, come work with me for 3 or 6 months or a year. Don't go do your IVF process. That's dangerous. And I really want
Yes.
to say, please don't do that because there are important markers and values and perhaps diagnostic testing and treatments that you may need in order to have your own success. As you say, acupuncture, Chinese medicine, supplements, even diet and lifestyle will not change a structural issue, the shape of your uterus, but it will change biological markers, physiology, such that your own organs and tissues are healthier for when it's time to go to your IVF doc.
Yes,
Yeah.
100%. So, having said that, what are the things that you find are most helpful for people as they're starting to embark on their fertility journey? Of course, we see a lot of people who have male factor infertility or maybe ovarian aging or some other issues like PCOS or endometriosis. Where do you feel that Chinese medicine can come in, acupuncture, supplements, all of those things can come in and assist in some of those difficulties?
Yeah, certainly. And I just want to preface it by saying, acupuncture is but one tool in the toolbox of the Chinese medicine doc. And you also want to have a fertility specialist. We know that this is a complex process that requires comprehensive knowledge in order to address it. But
Mhm.
that being said, we know, for instance, that endometriosis is an inflammatory condition. PCOS is also an inflammatory condition with insulin issues. Diminished ovarian reserve is an issue of mitochondrial waning, shall we say. And so, where Chinese medicine can help is that we address what I call the four pillars of health. It is our diet and hydration, our nutrition and hydration, our circulation, our whole body circulation, and then the targeted circulation to our reproductive organs. It is our sleep wake cycle, because that's where we do a lot of our detoxification at night and healing and restoration. And then it's our mind body approach. And of course, that's where your specialty is. You could probably speak
Mm,
to that more than I can, because mine is more esoteric and in the realm, if you will, of the five elements of Chinese medicine. But within Chinese medicine, we don't look for diagnosis directly. We look for patterns of
hmm.
imbalance, and then we can name the diagnosis based upon those imbalances. Should I elaborate? Would you like me?
Yes,
Okay.
please.
So
Yes.
for instance, the PCOS person, we would look at these patterns and say this person is actually accumulating too much waste product. She is not able to really efficiently do her detoxification methylation at her liver. Therefore, her insulin is higher. Therefore, her messaging all the way down to her ovaries. And forgive me, I'm using pronoun her. So we
Hmm.
know that it's everybody. And that's what's causing in the follicular fluid itself inside of her ovaries, within which that egg is growing, elevated insulin markers, elevated inflammatory markers. So we can make these changes with diet and nutrition. And now we know we've got great supplements that also help support this, many of which, by the way, are derived from herbal medicines, right? So at this point, it's much more easy and efficient and works better with the conventional medicine doc to use a supplement than an herb sometimes, because the
Hmm.
docs need to know that they have, kind of an understanding of what's taking place. But that's an example. We would call that person spleen deficient, because we call the digestive system spleen. And we would then work to help make the changes that would then improve her outcome. She will lose weight, because oftentimes PCOS will have a weight issue. And even if she doesn't, she will lower her insulin resistance so that the symphony, if you will, of hormonal communication from the brain to the ovaries is improved, and she can restore her regular cycling. That's one example.
And so, for let's say a patient like that, would you recommend to, once you evaluate them, would you often recommend a combination of those things?
Yes, absolutely. Everybody gets a combination of these, of the nutrition, hydration, circulation, sleep wake cycle, and stress management, because that's life, right? That's what we do with life. We would just tailor it a little differently for the PCOS person as compared to perhaps the premature ovarian insufficiency patient or the diminished ovarian reserve patient. Their needs are different. And I think that that's a really key point I want to address in the Dr. Google world out there. There's,
Hmm.
this supplement worked for me. So our tendency and our desperation is to run and get that supplement. Well,
Yes.
we don't know what that person's physiology is, where that supplement worked for her, for that person. And so therefore it may or may not work for you. And it may actually interrupt your own healthy patterns. I'm thinking of Vitex, for instance. Vitex is something that, is wonderful if someone is having difficulty with ovulation. But if somebody's having a shortened luteal phase, Vitex may not be, and I would purport, is probably not the thing you need. We want to help you in your follicular phase if you're having a shortened luteal phase.
I see.
Mhm.
So, all of these things may be able to help a person with a specific diagnosis, but even within that diagnosis, there are a lot of elements to consider, and they really need to look at the full picture.
Absolutely. Because here's the thing, we don't want to just have a positive pregnancy test, right? We want to have a healthy pregnancy, a healthy baby, and a healthy postpartum. And making these changes before, or even you can begin any time during your IVF cycle, it will have a beneficial outcome for when during pregnancy, for the baby during pregnancy.
So, now that we're talking about supplements a little bit,
Mhm.
what about the next step, like nutrition?
Mhm.
Is that prescribed similarly, that each person is going to have a different sort of profile and will need to have different diets?
I try to get lenient around the diet, because I think that we can, feel that there's just too much to do. So I will, but yes, I will tailor it a little differently. So the person who has the PCOS, we'll stick with that. For example, we really want more warming kind of foods and spices in her diet, because that will
Mhm.
help lower some inflammation and will also help to we say kind of resolve some of this phlegm that is accumulating that we're calling these unruptured follicles. So she would have more of a warming style recommendation for her foods, whereas perhaps somebody who maybe was a little premature ovarian failure would like she might have like low blood quality, and so we would be giving her more blood nutrient rich foods to help to really get that those nutrients to her whole body and her ovaries. She might be one who's a little bit tending toward the anemia, and so we really want to help boost that up so that she's ready for a healthy retrieval and pregnancy.
So maybe she'd have more broccoli, for example, for iron or something like that.
Possibly, for yes. In fact, they would both have broccoli because broccoli, as one of the cruciferous vegetables, is fabulous for the PCOS person. The cruciferous family really helps to take these once used and otherwise recirculating hormones and help to clear them from the body, because sometimes it is this accumulation, again, that word of hormones that are impeding the messaging from the brain down to the ovaries. So broccoli is good for everybody. So that would be
Mhm,
one, that would
mhm.
be one. But to maybe specify a little bit more in the spice realm, this PCOS person might do better to have the more warming sweet spices like cinnamon, nutmeg, clove, fennel, whereas the premature ovarian failure person, the person, premature ovarian insufficiency, I don't like the word failure,
Mhm.
person might need more like of the seeds, sesame seeds, black sesame seeds, things that are really going to provide within them a really rich, and we know these are, omegas, support to her nutrition.
And then there's hydration, which guess is good for everyone,
Imperative.
right?
We are relative, for the most part, kind of chronically dehydrated, right? We're not drinking enough water. We're drinking fluids, but we're not always drinking enough water to help our bodies, our cells cleanse themselves.
Yes, yes, absolutely. And that's universal, right? If everyone needs that.
Absolutely. Absolutely. Yes. Yeah. Yeah. I mean, water is the element that's going to get into the cell and help, clean out the debris and then help keep the cell wall supple and intact so that nutrients can get in and waste can get out. So yes, please, please, please be mindful of your hydration.
Absolutely. Well, that is very important for sure. Imagine your beautiful future. You're snuggling with your child. You feel so connected to them. Your friends and family are so happy, and you have everything that you've ever wanted. I want this for you too, but I want more than that. I want you to feel secure knowing that you've made the best decisions, not just short term, but long term for your future family. Wherever you are on your journey, whether you're choosing a donor, choosing a clinic, learning how to talk to your donor conceived child about their origins, all of these decisions will have wider implications for your future. And I want you to have the right resources so you can feel empowered and confident at this very important time in your life. That's why I'm so excited to introduce you to Building Your Family. It's the only expert guided platform designed for parents and parents to be using reproductive medicine. We provide unique strategies that you won't find anywhere else to make your path to parenthood smoother and more informed. And that's why our approach is about offering practical and actionable steps that you can use right now. Whether you're just starting out or already deep into your process, Building Your Family is here to guide you with expert advice, specialized education, stress reduction strategies, and a community to support you every step of the way. We can't wait to see you inside. And what about the exercise? There's so much controversy about that.
Yeah, and I'm going to preface this by saying, this is Chinese medicine speak, right? Because we really look to exercise a little bit differently through a woman's cycle. So in the menstrual phase where she's having her flow, we would say, please do your movement, your exercise, but be careful not to be twisting, torquing, or having a downward bearing kind of movement too much, because we want to make sure we don't have retrograde flow where the endometrial lining could push out through the fallopian tubes and into the cavity of the abdominal cavity, thus endometriosis. We really want it to be able to flow out where it's supposed to. So walking, hiking, certain yoga poses, just be careful not to have too much downward, pressure on your body. And then during the follicular phase, go for it. The ovaries are nice and small, they're growing toward ovulation, but this is when you really have the freedom to, if you love to do high intensity interval training, if you love to do whatever it is that's going to be a little bit more exertive, by all means go for that.
Headstands.
Post ovulation, in that window, 6 to 8 days post ovulation, where an embryo, God willing, is in the fallopian tubes. Once again, we don't want too much twisting, torquing, because we want the blood flow to be able to support this embryo moving from the tubes into the uterus for implantation. And
Mhm.
then at implantation time, once again, we say, get your circulation, get your movement, but be mindful of not too much downward bearing pressure. The likelihood in that a leg press is going to create a miscarriage is slim, right? A healthy embryo is going to implant, but,
Right.
but this with the Chinese medicine mindset, we just take these extra precautions to say this would be another time to walk the dog, take a lovely hike, swim,
Mhm.
but try to keep your body in its straight your hips, your pelvis in its straight anatomical position.
That's so interesting. So the whole idea is really just to look at your cycle. And if you're somebody who doesn't really have a natural cycle and it's very confusing for them and they're very irregular, then it might be better, I'm assuming, just not to do as many of those upside down moves.
Yeah, if you can avoid it. Again, and part of the beauty of having this awareness of where you are in your cycle, if you can, and even if it's not, if your body's not showing you where you are in your cycle, you're engaging with your body consciously, right? This is part of our conversation with psychology and therapy, is that you want to engage consciously with where you are, so that you
Mhm.
feel, I don't know if the control is the word, but you feel better engaged. You have more agency over
Yes.
what is happening in your body, in your life on this day, in this moment.
Yes, absolutely. And that I think is just by itself, apart from whatever benefits people receive from the Chinese medicine, just to be able to do something about your difficulty, to feel like you're contributing to whatever success or improvement you can is so helpful because you can feel so out of control and you're not in the driver's seat, right? You're always waiting for the next doctor's appointment or when is it going to happen? And you feel so out of control. And so being able to do things to help yourself, it does put you back in the driver's seat to some degree.
Absolutely. And what does that out of control feeling do? Increases cortisol,
Right.
which is
Exactly.
which is sort of antithetical to what we want to do. So doing what you
Exactly.
can to reclaim your agency over your experience has exponential benefits.
Yes. Yes, for sure. And I think, as you said in the beginning, you had that experience yourself that you were experiencing all of these physical symptoms that were manifesting themselves as a result of stuff that was happening for you emotionally. And so that was really helpful. Now, I think we also have to balance it a little bit with this idea that, people do feel responsible and they feel like if I'm not getting pregnant, maybe I'm doing something wrong
Mm.
and I should be able to control this. And how come my sister got pregnant and I'm not? And I'm doing everything right. And why can't I get pregnant? So I think it's also important for everyone to remember that it's not about fault. You're not doing anything wrong. These are things that might be able to help your overall health. But if you don't do them all, it's not going to be, necessarily change your life, right? You need to be able to do what works for you. Everybody needs to do what works for them, and we have to remember that that's all we really can do, right? And so it's important not to blame yourself and not to look at yourself as a cause of the problem. And if you can't get your stress level down, that's okay too. We have to just keep going and do what we can.
Absolutely, absolutely. I try to use I try to remove the word control from the conversation, because we don't have control. We have engagement. And
Mhm.
so my recommendation to patients is, to the best of your ability, give yourself 100% engagement and then 100% surrender, because this time in life is one in which we don't have control. We have control over certain areas of our life. If you do these courses, you get this degree, you get that job
Mhm.
probably. but
Right.
but in the bigger capital life picture, we must engage and we must surrender, because that's what creates the space in our bodies and in our minds and in our spirits, whatever your belief system is, to really then allow for healing to take place and for life to occur. And we don't know. There is no guarantee. There's never a guarantee in the capital L
Mhm.
life, but there is the opportunity, the gift of engaging with it as fully as we can.
That's a great way to frame it, Susan. I think that
Thank you.
that's really, really helpful.
Thank you. Yeah, I do see so many of my patients are successful career people, with multiple degrees, and they'll come in saying, "How do I not know this about these fundamental things about my own body?" And I say, "Because you were never taught. You know what you know
Mhm.
because you were
Mhm.
taught, and so now you're learning this." So again, no blame, no shame, no, I should have. Let's start now.
Right. That's great. That's great. And then finally, what about the sleep? There's a
Yeah.
lot of discussion about sleep now, and people are starting to track their sleep and be mindful about their sleep. Can you tell us a little bit about what, from a Chinese medicine perspective, we can do about our sleep cycles, and how important is that to our health?
Well, it's critical, is what I will say. So, to the best of your ability, we want to be in harmony with the sunrise and the sunset. And so, the sun begins to set, and the light goes from a high blue light of high noon to a more yellowish light. So, we want to mimic that in our indoors. So,
Mm.
either change light bulbs or have some light bulbs that are a little bit more of the yellow, orange hue or red hue. Dim the lights, turn off some lights, so that you're letting your own pineal gland get the message, oh, dusk is approaching, dark is approaching, and it will begin to secrete its first antioxidant, of the evening, melatonin, which then also helps to create this sort of sleepy sensation, and it will help us get through a good night's sleep. In the Chinese medicine clock, we say that our detoxification begins at 11 o'clock with the liver. Those are the hours of the liver. And so I recommend to patients that if you can, try to be asleep by 11 o'clock. This is
Hmm.
kind of what we typically do in our everyday life anyway. But there are folks who are like, oh, I don't go to bed until midnight, 2 a.m. because I'm just, on the computer. And I say, well, how about we try, just test and see what happens if you
Mhm.
pull
Yes.
it back and get to bed earlier and get more hours of sleep. And then we talk about mood, right? The brain is the last organ in this cycle to have its opportunity to dump its toxins. And so it will improve our mood if we get our quality sleep, the duration and the depth of sleep. Whether or not you use devices, I mean, devices are a great way to track, but it's not for everybody. Personally, it's not for me because the device itself wakes me up with the red light that's in the ring. So I
Mhm.
just will use it on occasion, but I will otherwise just say I kind of know if I've slept or not. So 11 p.m. to 6 or 7 a.m. is ideal. So get
Hmm.
those blue light devices, TV, computer, Kindles, whatever else you're using. I forget what they're called. I'm using the term Kindle, but the readers.
Mhm.
You turn them to dark mode, turn them off maybe at least 30 minutes before, ideally an hour before it's bedtime. Create a lovely sleep hygiene ritual for yourself.
That's great. I've also heard that there's some ideas about overhead lights and how there may be some difficulty with your brain thinking that it's daytime if there's overhead lights on as opposed to just lamps around the house.
Yeah. Well, I mean, typically overhead lights are those bright blue LED lights, right? I don't think I've ever seen an overhead light that is red or
Mhm.
orange. So it might just be less about the location being high noon, but more about the brightness. So
Hmm.
I really can't answer that with authority, but it's curious.
Well, our bodies are not accustomed, even though, we've lived for generations indoors, our bodies really are not made to adapt to modern life. And so it is so important.
Absolutely. I was just listening to a talk this week about that, we're using these bodies that are still primitive in their physiology and trying to push those bodies through this modern technological, era that we're living in. And so the onus is upon us to do what we can to kind of remember that we are human beings, carbon beings, and
Hmm.
and to really support these bodies that are taking us through this lifetime to the best of our ability by making these slight adjustments. We feel better. I mean, it's again, some of this almost feels silly in that it's common sense, but we're not doing it. But try it and you will feel better. I guarantee. If you get how you go to bed is going to affect how you wake up. How you wake up is going to affect how you go to bed. So by the way, how you wake up, get your face to the natural sunlight as soon as you
Hmm.
can. It will begin to make the adjustments to your biological markers, adenosine, so that you can start to wake up for the day and get moving, and that will begin to set the clock, if you will, which will help you at dusk o'clock to say, oh yes, I do want to begin the ritual of getting ready for dark and bed and sleep.
Can you do that through the window or do you need to go outside?
You can do it through the window. It's ideal to really get your face, to the direct sun. If you can, remove your glasses because that morning sun is not, harmful. The rays are not harmful. To just, really get those rays directly to your eyes. So you can do it through the window, but it's optimal to get your face outside
Outside.
and toward the facing the sun just for a couple of minutes. So again,
Hmm.
walk the dog.
Hmm.
Our dogs are kind of like our best doctors almost in terms of having us be adherent to the natural things we can do to improve our health.
Move our body and get some sun.
Hmm. Hmm. And laugh.
Uh-huh. Right. Feel joyful.
Hmm.
That's great. And then what about, so all of these elements are really important. We're talking about them in the context of a female body or a body with ovaries.
Hmm.
What about with regard to male fertility or
Yeah.
sperm health? Because I suspect it's easier in some ways to change that because the sperms regenerate every 3 months. And so, what are the sorts of things that people should be thinking about with regard to Chinese medicine in general, but also into these specific things they can do at home?
Yeah. Well, interestingly enough, and this is great for when people are a couple, it's not much different. Body health, whether it's male health, sperm health, or female health, ovarian health, these fundamental changes will have remarkable effects. So sperm can be more prone to oxidative stress because the gonads are sitting outside the body. So you want to make sure that they're not overheated. You want to not have some of this is probably so redundant. You don't want your cell phone in your front pocket. And ideally, you don't even want it in your back pocket.
Mhm.
So it's because you don't want to increase heat and radiation so close to where sperm is being made. But truthfully, it's again, and I'm delighted because this is really what makes it easier for a couple to work together on this: nutrition, hydration, circulation, and proper sleep. And I would say that for the males, sometimes the proper sleep can be a little bit more challenging, has been my observation. So
Hmm.
that's something that, since it can be more challenging, I can't explain why. It's just sort of an observation, but it's a easy one. Well, it's a simple one, maybe sometimes not so easy, to begin to make those changes, to get to bed early, to not watch TV in bed and fall asleep with the blue light in your face.
Well, that's great advice. And
Yeah.
I think it's also important for all of everyone out there to think about that regardless of your circumstance, because 1 in 6 people do have infertility challenges. And even the patients that I see are who are part of a same-sex couple or single people, they are really focused on getting the other parts that they need. And it's really important to remember that we're all equally vulnerable to infertility issues and other problems. And so this is really good advice for everyone, no matter how you're planning your family.
And I would even share that again. My observation is fertility struggle can be a challenge on the relationship itself. So
Yes.
when a couple is doing the work together, if you will, I don't know if I would want to call it work,
Mhm.
making the changes together, it does bond them in a way that they remember that they're a couple and that they want to be a couple. That it's not just about
Mhm.
this problem that they're trying to address, but they're taking this adventure together and making the changes together that will improve their health. Because you want a healthy mama and papa as well, or healthy mama and mama.
Mhm.
But
Mhm.
you want the sperm health to be healthy as well.
Yes, for sure. And I think that that's kind of going back to what we were saying before, does give you that feeling of agency
Yes.
where you're doing things that could potentially help your fertility. And as you're saying, if you're doing them together, then you can feel that here's a place where maybe otherwise you have differences of opinions about all sorts of things, including your fertility journey.
Yeah.
But maybe here's a place where you can unite and you can work on a project together and both feel like you're in the driver's seat together, which is really a wonderful experience and can really change the way you manage your journey.
Yeah, and both feel better. I mean, these things, we just feel better, and so our moods are elevated. We're not feeling quite as stressed, and looking for a culprit as to why we're feeling stressed. So everything just elevates a little bit. I do want to put one plug in, if you will, to say when we talk about male health, sperm health, please do get your semen analysis, because yes, 1 in 6 couples is or people are struggling with fertility challenge, and about 30 to 40% of that is male factor. So don't just go down the route of looking at ovaries and uterus and tubes and all of that. Please
Hmm.
get a thorough reproductive hormone semen analysis.
Yes. And I think all of these things might be utilized by the man too, even though I think we see in many fertility clinics, people will use acupuncture, before a transfer, or maybe they'll use it during the cycle to lower their stress, that the men can use it as well. It can help them lower their stress, and all of these things can be beneficial for them too.
Absolutely. And yes, if I may, whether it's acupuncture or any way you stimulate your acupuncture points or stimulate blood flow to ovaries, uterus, gonads, I would say don't think that it's just the day of transfer acupuncture. That's in the Wayback Machine. That was like one of the first research trials that was done. That was
Yes.
wonderful because it improved outcomes. But it's what you do in the time prior to the date of transfer that's going to have as big, if not a bigger impact. And that's the research has borne that out to be true as well, that when we see acupuncture, because again most of the research is on acupuncture, up to 3 months prior, the outcomes are significantly, statistically significantly improved.
Right. And we were just talking about this on the podcast before about sperm health and how changing your diet, not taking the extra testosterone, stopping smoking, all of these things can make such a big difference.
Absolutely do not take supplemental testosterone unless it's under the medically supervised recommendation of your reproductive urologist. And I'd be very surprised if they chose to do that. Usually there are other medications that will help you produce your sperm better. And taking testosterone will inhibit your own body's ability to produce testosterone.
Yes.
Thanks for that highlight. That's important.
Yes, very important, very important. And this is such great information, Susan. Do you feel like we're missing anything?
Let me see. I think the only thing that I would add to this is make sure you find the right support system. We work for
Mhm.
you. So if someone is instilling, fear or
Yes.
in you, then that should not be your tribe. And be mindful or cautious of the many groups out there that I believe their intentions are good, but that whole crab in the pot theory of if I'm boiling, come down and boil with me.
Mm.
I get a little nervous about this, how supportive those support structures are. So reputable support vehicles like Resolve, like ASRM are the ones
Mhm.
that you want to find your resources from. And they've got many resources. And again, I mean no disrespect to the many people who might be out there trying to help. But if someone is not, trained, credentialed, has a
Yes.
certification or a fellowship,
Yes.
I just don't want you to waste your time and money and resources and mental and physical health.
Yes, 100%. And time, right? Because if you go to someone who says, "Well, this worked for me," and so you try that thing, you could be wasting time as your eggs are getting older or as your sperm is getting more damaged over time or what have you. And it's really important to make sure that you find the right people and get the good evidence-based research behind you and make sure that the people and the providers that you're talking to are people who've seen thousands of people, not just, a few people in their practice.
True experts, yes.
Yeah.
And if I may, if this is an opportunity to put in a
Yes.
plug for an immersive event, we call it a summit, but we don't want to call it a summit because it's that much more. And Lisa is a guest expert speaker on this event. It includes these highly skilled expert professionals who are going to be sharing with you their knowledge and their remedies for the variety of health concerns that might be part of the fertility journey. Expert IVF docs, reproductive urologists, psychologists, psychiatrists, OBGYNs, pediatricians, and the list goes on and on. And it's called Best Prep for Pregnancy, naturally or through IVF. It will be held in March 23rd through 29th. It's a virtual event. And as I shared with Lisa, I just got the good news that there's a grand prize for someone, a trip for two to the Grand Cayman Islands and Bahamas that was offered as a sponsorship. So you can maybe get your baby moon in soon.
That's great. Well, it's always nice to have an added benefit, but I think
Exactly.
it's great that you put this together, Susan. And I think it'll help a lot of people because everyone's really looking for good information that will help them on their journey. So thank you for that. And we will put information in the show notes for sure. And where can people reach you, Susan?
So they can reach me at a couple of locations. If you're in California, and especially in Northern California, my website is drsusanfox.com, drsusanfox.com. If you're outside the state, I do have online coursework available that you can access and do in the comfort of your own home. And I've got a health and wellness coaching certificate that helps me work with you in that realm. And that is healthuniversity.co. And that's spelled YOU, health, YOU, university.co. You can find that through drsusanfox.com if it's hard to find. And then finally, if you just want to get started, there is a free quiz at yourfertilityquiz.com that will help you kind of find out what in your own body, mind, spirit might be going a little off, sideways, where we can help with a free report based upon the results of your quiz, make some corrections to your lifestyle that will improve your whole health and your fertile health.
That's wonderful. That's fantastic. Well, I hope everyone takes advantage of that because it sounds like a fantastic resource.
Yeah, thank you. It's this is my heart's desire is to help reverse this trend. I use the term subfertility because while there is infertility, structural issues and so forth, there's so much that we can do to improve our whole health and our fertile health. And we are subfertile at some degree. Sometimes it's
Mhm.
pretty serious. And that's where, thank goodness, we've got IVF and assisted reproductive therapies to help support us.
Yes, yeah, and that keeps getting better every day too, so it's wonderful. Well, thank you so much for coming, Susan. I really, really appreciate your time,
Thank
and for
you.
all of you out there, thank you so much for joining us. I hope this helped you, and please subscribe because that's how we keep going. It's so important to us. If we keep going, that we can give you all this information for free and continue to educate you and support you in the way that you deserve to be supported. So thank you again, and I will see you next week. Hi, it's Lisa Schumann. I hope that you enjoyed that video and I hope it helped you. And if it did, please give us a thumbs up and subscribe because that's how we keep going. It's really important to us. And if you liked it, you might like this one.